Okay, can everyone see that?
I can see it.
Okay. Funny you mentioned the exercise, because exercise actually helps in a lot of continence issues. I've actually had one client, it was a female, but so a lot of the things I'll talk about today, some of them apply to both men and women, but she actually had lost about 15 pounds and her continence issues were gone. So exercise, healthy eating, that kind of stuff, maintaining a healthy weight, very, very important. Okay, so again, I'm Ellie. I am a nurse specialized in wound ostomy and continence. Again, the continence specialty I've kind of just, I'm new to. So any questions that you don't have answered in my presentation today, or, there will be a question and answer session at the end. Anything that I'm unable to answer, I'll bring back to my colleagues who have more experience, and then I can forward those answers back to Ed to get to you guys, so you have some answers for your questions. So today I'm going to talk about urinary incontinence or urinary leakage in men with prostate cancer. Just a few things I'll talk about today in my presentation. We're going to go over a brief overview of the anatomy of the urinary system, just so when I mention things, you'll know what I'm talking about. The effects of prostate cancer and prostate cancer treatment on the urinary system. We'll look at an overview of urinary incontinence and then how management for urinary incontinence. So quick anatomy here. I just want to start, I don't know if you can see my mouse or not, but I'm circling this organ here. It's the bladder. So your bladder is actually, the outer layer is a muscle called the detrusor muscle. Oh, sorry, was someone asking something? Okay, so this is your bladder here. Letter A is pointing to it. So the outer layer of the bladder is a muscle. It's composed of smooth muscle, and it's called the detrusor muscle. So smooth muscle is actually a type of muscle that's controlled by the brain. We can't control it. So the brain actually tells it when to squeeze and when to relax. At the neck of the bladder, down kind of towards the bottom, at letter F here, that's the neck of the bladder. And there's actually a sphincter there, kind of like a doorway, also created from smooth muscle and controlled from the brain again. So the brain tells this kind of little sphincter trap door when it's okay to open and when it's okay to, contract, close to hold urine into the bladder. So there's a long tube-like structure that comes from the bladder and out down the penis, and that's the urethra. That's how your urine gets from the bladder to the outside of the body. If we look just below the internal sphincter there, this is your prostate gland. So prostate gland, its function is basically to produce some of the fluids that are in semen. A very common site for cancerous tumors. The urethra actually passes right through the prostate. And then the urethra keeps going down here. There's kind of this pinkish band. So those are actually muscles. It's called your pelvic floor muscles. And as the urethra passes through those muscles, there's another sphincter called the external sphincter, also created from muscle. So these muscles are kind of different from the muscles of the bladder. They're called striated muscles, and you can actually control them. So you can kind of choose when you squeeze them, when you contract them, and when you relax them. And that's important in continence. So there's 4 parts, of the urinary system that kind of are responsible for maintaining continence. So that's your bladder. It needs to be, stable, contract when it's supposed to, relax when it's supposed to. The second is this internal urinary sphincter that I talked about. The next part, the third part, is the prostatic urethra. So that's the urethra that kind of passes through the prostate. The prostate adds some extra support to that part of the urethra, so it kind of, prevents urine from leaking out. And then the final mechanism is the external sphincter and the pelvic floor together here. So I'm going to talk a little bit about prostate cancer and, the treatments for prostate cancer and how these can affect the urinary system. So prostate cancer occurs when there's an abnormal and out of control growth of cells in the prostate gland. And these abnormal cells create a tumor. This picture here, so when you get a tumor in your prostate and it starts to, kind of spread, it can cause the prostate to enlarge. However, the prostate can just enlarges kind of on its own normally as a man ages. It's due to a change in hormones. Usually cancer is not the cause. It's known as benign prostate hyperplasia, or BPH. So just, enlarged prostate. What you can see here on the left, there's the normal prostate, normal size. And then on the right, you have kind of the enlarged one. And as you can see, as it gets bigger, it kind of starts to obstruct the urethra. When you have, the prostate kind of blocking the urethra like that, it's harder for the urine to exit. And symptoms you might experience include frequent urination, a weak or interrupted flow of urine, voiding at night. And this is usually because, your bladder can't empty completely. So you're always going to have kind of a full bladder. So even when at nighttime, you're always feeling the need to pee. Pain or burning can also occur, blood in the urine. New erectile dysfunction. There's lots of nerves that surround the prostate gland. So when it enlarges, it can kind of disrupt these nerves and cause erectile dysfunction. And then also pain or discomfort while sitting due to an enlarged prostate. I'll go over now the different kind of types of treatment that you might have for prostate cancer and how it can affect the urinary system. So radical prostatectomy. It's kind of the, it's basically the, gold standard of treatment for prostate cancer. So the surgeon removes the prostate and the entire portion of the urethra that passes through it. The internal urinary sphincter is also removed during the surgery. And then the remaining urethra is stitched to what's left of the neck of the bladder. So as you can see in this picture here, the before, there's kind of the cancerous prostate. And in the after picture is just the rest of the urethra kind of reattached to the bottom of the bladder there. One of the major side effects of this surgery is urinary incontinence. Almost all men will have urinary leakage when the catheter comes out after surgery. What I will mention too, during the surgery, so after they've stitched together what's left of the urethra to the bladder, you'll get a catheter inserted. So kind of a long tube inserted up the urethra, it'll sit in your bladder. A balloon will be kind of blown up in there to keep it from the catheter from falling out. And that's to protect the sutured area so that urine's not passing through it. It's going to go through the catheter. You'll have the catheter for 1 to 2 weeks, generally, based on the surgeon. But yeah, once that catheter comes out, basically all men will experience some, type of leakage. Because during the surgery, you're removing some of those mechanisms that are needed to maintain continence. After surgery, it's now the responsibility of that external sphincter and your pelvic floor to maintain continence. However, unfortunately, during surgery, that external sphincter can become traumatized temporarily, and you may not be able to hold your urine at all. And again, usually just temporary, you usually maintain, or you get back most of the function pretty quickly. So you and your friend both had surgery. Why do I leak more than my friend did? So this depends on a few things. Your preoperative continence status. So if you had issues with your bladder and you were leaking urine before surgery, you'll probably have those problems after surgery as well. Whether or not, so depending on the aggressiveness of your cancer, whether or not they could spare, you know, the nerves that are surrounding the prostate or not. Age, as one ages, there's some of this like muscle cells in that sphincter in the pelvic floor kind of die. So it's going to be less strong to begin with. Urethral length. So the longer the urethra, the more resistance to urine leaking. This is why, so women can also, you know, leak urine, but their urethras are much shorter. So it's a lot more common in women. But however, you can also see it in men that had this surgery because you're taking out some of those continence mechanisms. Radiation can also affect it, as well as obesity. So especially if you hold weight in your belly region, it increases pressure in your abdomen, which then pushes on the bladder. And then if your pelvic floor is not strong enough to kind of counteract that pressure, then you're going to have leakage of urine. So that's why exercise, and of course, not right after surgery, because there's some heavy lifting, you know, they don't want you to heavy lift for a while and you can't go right back to whatever exercise routine you were in right away. But that's why, you know, maintaining a healthy weight is really important. Other treatment, radiation. So that's when they kind of shoot like X-ray beams from the outside of your body. It's directed and pointing at your prostate to try and kill the cancer cells. But when this happens, it can also kind of damage the tissues around your prostate as well. So side effects that you would see with radiation could include increased urge to urinate or increased frequency of urination. So like having to pee more. And this is because the bladder is right next to the prostate. It's also affected, getting irritated. Problems with sexual function, problems with bowel function, since your bowels are very close in proximity as well. And then fatigue or tiredness. Side effects usually subside after treatment. However, sometimes you can get some long-term damage to some of your organs from radiation. And then a newer kind of treatment is brachytherapy. So this is actually the insertion of radioactive seeds directly into the prostate. And then the side effects you would get are similar to that of, you know, external radiation, in that whatever organs are nearby are going to be kind of affected. Okay, so what causes leakage? Urinary leakage can occur due to dysfunction of the bladder or dysfunction of the urinary sphincters, or both. There's a couple types of urinary incontinence that we'll discuss today. So stress, urge. Mixed is actually stress and urge together. And then there's an overflow. And I'm going to kind of go and kind of discuss all of them today. Stress would be the major type that, you know, you would experience after a radical prostatectomy, and you'll see why. So as I kind of explain each type of incontinence as well, I'm going to kind of give some management and treatment options. As a nurse specialized in continence, in our continence clinic, we offer what's considered first-line therapy or behavioral, lifestyle, and intake modifications. Things you can do that, you know, are safe, that kind of thing. We kind of take a stepwise approach when treating incontinence, because as you get into like the second line therapy, which is medications have side effects. And then the third line would be more, you know, interventions that have more risk to them, like surgery or injections and stuff like that. So when I talk about treatment, I'll talk about kind of like in that order. We'll do behavioral, lifestyle modifications first. And then I will also just show you guys like what kind of medications can be used and then what kind of surgeries. But as a nurse and in our continence clinic, we solely do the first line therapies, and we offer that first. Okay, so stress urinary incontinence. Again, this is the most common type of incontinence in males after they have the RP or the radical prostatectomy surgery. So stress incontinence is leakage that's associated with an increased pressure in the abdomen. So things like coughing, sneezing, lifting heavy objects, they all cause stress in your abdomen that pushes down on your bladder. And like, think if you have like a water balloon, like you're pushing down on the bladder, like eventually if you're where the balloon's tied up, if that's not strong enough, you're gonna basically just, all the water is gonna come out of the balloon. So stress urinary incontinence is a result of sphincter dysfunction, and in radical prostatectomy, we're removing one of the sphincters, and then another of the sphincter that's left over is damaged. So that's basically what's happening. If you cough, there's extra pressure on your bladder, and then if your pelvic floor and your external sphincter.
All right, you heading up home now?
Yeah.
Okay, I'm looking at a video here that I wanted for my cancer stuff. So.
What do you mean by cancer stuff?
Well, I had prostate cancer. Yeah. What's going on here?
Richard, I can hear you. I can hear you.
Oh, sorry.
It's okay. You're just part of the presentation now forever because it's being recorded.
I'll be quiet.
No problem. Okay, so management of stress incontinence. Pelvic floor muscle exercises, also known as Kegels, are the mainstay behavioral intervention for treating incontinence following RP surgery. As I said before, you're able to control your pelvic floor muscles. And since you can control them, and since they're kind of attached to that external sphincter, you can actually make them stronger. And the whole kind of problem with stress incontinence is a weak pelvic floor and a weak external sphincter. So these pelvic floor exercises kind of strengthen that. That's basically the main, the best thing you can do to kind of treat this kind of incontinence. These exercises can be done before you go for your surgery. They can be done immediately after, or they can be started anytime after surgery. Once you start, a routine of the exercises, you can start to see sometimes results in about 6 weeks. Like, it does take a long time. It's like building muscle, like how you would at the gym with your biceps or something. So you can start to see results after 6 weeks, but sometimes it can take up to 6 months. So I have a video here, and I thought, since, the Kegel exercises are so important, that I would include this in the video. It will show you exactly how to isolate them, how to exercise them. Yeah, great for men and women too. So I'm going to just play this here.
Hi, I'm Michelle, and today I'm going to guide you through pelvic floor muscle training to stop bladder leakage after prostate surgery. Now, some of this training information is based on a recent research article, and it's linked in the description below if you'd like to access it. Now, the authors really emphasise the importance of individualised treatment, so please consult with a pelvic floor physiotherapist for your post-op management if you're able to. Now, today we're going to cover when and where to start your pelvic floor exercises, also how to do your pelvic floor exercises when you're starting out after surgery, 2 ways to test your exercises, and also how many exercises you need to do to get good results. Now, you can usually start your pelvic floor training with your surgeon's approval, and this is after your catheter's been removed. It's also very beneficial for bladder control if you can start this pelvic floor training before your surgery. Now, you can start your exercises in any one of the following positions: lying down with your feet flat and your knees bent, over a couple of pillows if you can, or semi-reclined, perhaps in a reclined lounge, or standing upright, particularly if you're familiar with standing pelvic floor exercises and pelvic floor training. Now, if you're currently troubled by leakage, then I really recommend doing your exercises reclined for the first 2 or 3 weeks. Now, let's go through how to do your pelvic floor exercises for bladder control. If you review your pelvic floor muscles, you'll be exercising these muscles during your pelvic training. Your pelvic floor muscles are in and around the area where you sit, as you can see here. Some of the muscles we're focusing on for your bladder control sit at the base of your penis, and they wrap around the base of the penis, along with a muscle that sits deeper inside around your urine tube. Here's how to exercise these muscles to stop bladder leakage. There's 2 parts to doing this exercise correctly. We're going to do each part separately, and then we're going to put them both together. Now, the first part of your exercise involves shortening your penis or drawing it inwards, similar to the way a turtle would pull its head back into its shell. Start by relaxing your breathing. Relax your buttocks and your belly. Now breathe in, and as you breathe out, gently shorten your penis by drawing it inwards towards your body. And now relax. Let's repeat the same exercise again, keeping it gentle, and see if you can do this for 2 to 3 seconds if you're able to. If you're having trouble, try to imagine the action of peeing upwards on the wall. All right, start now, breathe in, and now as you breathe out, shorten your penis for 1 and 2, and now relax. How did you go using this technique? Please try not to worry if this seems challenging at first, because this exercise can really take some time to learn. Now, here's the second part of this exercise. This time I want you to try to contract as if you're gently stopping the flow of urine or just slowing it down a little. Start with your relaxed breathing, relaxing your thighs, your buttocks and your belly. Here we go, breathe in. And as you breathe out, gently contract your muscles as if you're trying to stop the flow. Try to keep contracting for another second or 2. Breathe in throughout if you can. And now take a rest. All right, we've done the 2 parts. Now let's put parts 1 and 2 together. And this is the correct action for your pelvic floor training. Now don't forget, at the start, this needs to be really gentle. Just focus on really good quality and good form rather than contracting strongly. That can come later on. All right, let's start now. Breathe in, and as you breathe out, just gently stop the flow of urine and shorten the penis. Try to keep breathing and hold your muscles contracted for 1 and 2, and now relax right back to resting. Now this is the correct exercise for you to practice, shortening the penis and stopping the flow at the same time. So remember, the key points are to try to breathe normally and to keep your upper belly relaxed throughout the exercises. Now, there's a couple of good ways to know and to test whether you're doing these exercises correctly, because sometimes it's just hard to know. You can test by trying to stop or slow the flow of urine, but you do this just once a week and as a test, not an exercise, just to see if you're using the correct muscles. The other way to test is to stand side onto a mirror. When you use the correct technique, if you're standing side on, you can see your penis move slightly inwards towards your body. Now, how many exercises to start with? This is a big question. I want you to try to start out with 2 to 3 second holds, so they're only a couple of seconds. Repeat these exercises just gently, doing the number of exercises you can manage, up to say 5 or even 10 times in a row if you can do that many. Try and do this routine 2 to 3 times a day. To progress these exercises over the next 2 to 3 weeks, try to hold your exercises for up to 10 seconds and repeat them up to 10 times in a row if you can. But remember, just do what you can manage using really good technique. Remember that it can take a number of weeks to improve your bladder control through exercise. The key is regular practice and progressing your training as your strength improves. I hope this information is helpful for your recovery. I'd really appreciate it if you can give this video the thumbs up if this video helps you. So if you'd like to see more pelvic floor training for bladder control, or if you have any questions, please let me know in the comments.
Okay. So other management for stress urinary incontinence, like I had mentioned, weight reduction. So the extra body fat in the belly region can cause the increased pressure on the bladder. And then, so weight loss through either healthy eating or exercise can help with that. In the continence clinic, we do have a registered dietitian that we ask to see clients when needed. So that's an option too, if anyone ever needs to, you know, come see Sarah or myself or one of the other girls in the continence clinic, we do have that option, or you can ask your doctor for a referral. Okay, so the use of absorbent products or devices can be used to contain urine. So some individuals may experience leakage for just a short period of time, such as immediately after the catheter is removed. Products are generally chosen on how much leakage you have, but it all comes down to patient preference. So some people may feel more secure in like a more of a bulky, like diaper type liner, while others may want something more discreet that you can't really notice. So the goal of absorbent products is to wear the smallest amount of product possible, and then gradually kind of work your way towards product-free living. So to do this, what you can try, if say you're gonna use a pad, only wear the pads when you go out in public. Because when you're out in public, if you have a leak, it can be, you know, embarrassing. You're far from home, then you have to come all the way home, get a new pair of pants, something like that. So you can wear the products when you're out, but when you're home, and you know, having a little bit of leakage isn't a big deal, go without the products. That way you're kind of focusing your brain on, okay, try not to leak because I don't have that crutch of an incontinence product to kind of be backup. So just in the photos that I posted here, so this one on the left, kind of like a pull-up brief kind of version. The thing with these though, if you say are out and you're wearing trousers, it's difficult to change them when you have like pants over top, because you have to take the pants completely off to remove them. The next product here is kind of like a male pouch pad. So different than what you would, different from a normal pad or what you would see like a feminine product, that like a panty liner kind of thing. This one kind of is more of a pouch shape. It kind of cups the penis and the scrotum together, and it actually, I think, prevents more leakage for men. There's a little indicator on the packaging that kind of indicates how much leakage that particular product can handle. Top right corner, so there's just a question about penile clamps. I don't think they're very common. I think you need to have kind of like an expert kind of fit them to you, because there is a risk of cutting off blood flow with use for them. So what they basically do, you kind of clamp it over your penis, and it kind of adds some compression to the urethra to prevent leakage. And then in the bottom right corner here, this is just, it's called a condom catheter. If you have a lot of leakage, there's basically these tips that go on the penis, and then they connect to a urinary catheter collection bag, like similar to the one that would be connected to your catheter post-surgery. A lot of these products can be purchased online, or, you know, from like Shoppers Wellwise, Walmart, that kind of thing. The thing like the condom catheter, that would be more towards like Shoppers Wellwise, where they have like a lot more like health products, like in that sort of like in the continence kind of section. So skincare. So urine, when it kind of sits on your skin for a long period of time, it can cause it to become red and painful. So skin damage related to incontinence is called incontinence-associated dermatitis. Some tips to help prevent this include removing any wet or soiled product immediately, and then cleansing and drying the area. Products that you use for cleansing should be pH balanced, alcohol-free. They shouldn't have any scents to them. After washing, you want to moisturize the area. And then finally, you want to protect the skin. So there's some barrier products on the market and that are designed to kind of prevent the penetration of urine onto the skin. The picture I have in this slide is actually a product called Baza Cleanse and Protect, and it actually does all three of those jobs all in one step. So you can buy this on Amazon. You can buy it from Shoppers Wellwise. At our continence clinic, we actually have little packets that we give for samples. So if your dermatitis kind of starts to get a little worse and it results in skin loss or like weeping skin, like your skin starts to kind of slough off, you might need something a little more advanced. So the bottom left corner is called Isles paste. It's basically like baby diaper cream. However, the Isles paste needs a prescription, but you can use certainly like a Peniton, like any kind of diaper baby cream. And that's good for the skin. If if your rash kind of becomes really itchy, and in this picture here, you notice, some little satellite lesions, we call them, around the edge, and it has like kind of a yeasty smell. There might be actually like a fungal component growing, like a yeast infection on the skin, because fungus likes to grow in moist, warm places. Trying an over-the-counter, like going to the pharmacy and getting an over-the-counter antifungal cream, you could try doing that. If the rash doesn't clear up, I would talk to your doctor. You might need something, a little stronger, or maybe it's not actually a fungus causing the rash. Maybe it's something else. So I would refer to your doctor if, the skin condition starts to get unmanageable. So those were kind of the first line therapies. So second line, again, is medication. So there's some medications available that increase muscle tone in the bladder neck and the external sphincter. I don't think I mentioned another name for the external sphincter is the rhabdosphincter. So if you see that throughout my presentation, that's what that means. So you can certainly talk to your urologist or doctor about these kind of medications if the first line behavioral therapies don't really work. Another option for stress incontinence are collagen injections into the bladder neck. And then a third line therapy is surgical interventions. So the top right corner here is a synthetic sling. So it's using kind of the synthetic tape that, if you can see here, it kind of goes underneath the penis and urethra, and it kind of pulls the urethra up a bit, repositions it, and add some compression to it to help with leakage. You can certainly still have leakage afterwards with this surgery. It can occur. And then this bottom picture here is an artificial sphincter. So they kind of put like a little pump and stuff, and there's a little cuff that inflates around your urethra, and when you actually can't void with it when it's inflated. So what you would do, there's a little pump, and you can see down here you actually hit the pump, and then the fluid goes from the cuff up into this little balloon that's up here temporarily so that you can pee. So again, there's some issues that can occur with surgeries. There's always, bad things that can happen. So it's always good to try and start with like the first line therapies first and then progress from there. So incontinence during sexual intercourse. Another bothersome symptom is the leakage during intercourse. So sexual stimulation actually puts pressure on your bladder and urethra, and then combined with a weak pelvic floor and sphincter, it can cause stress incontinence. Climacturia is the term for orgasm-associated urinary incontinence. 9 to 59% of men will get this at some point following surgery. Usually occurs 6 to 12 months after the surgery, and that's usually around the time when like sexual function starts to come back, and when people start to have sex again. So management tips to prevent from leaking during sex would be to empty the bladder prior to engaging in sexual activities. Watch your fluid intake prior and try to limit it beforehand so there's not excess urine in your bladder. Avoid irritating foods and fluids prior. Condoms may hold a small amount of urine if you're having a little bit of leakage. And then I'm actually not familiar with this, but I kind of researched it just for the presentation. This device here in this picture is called a Eurostop. kind of like a little loop that goes around the base of the penis. I think it adds some support and compression to the urethra to prevent leakage. But certainly do some research on that before you go and buy it, because yeah, I don't know too much about it. Okay, so incontinence can also be caused by problems from the bladder. Urge incontinence is caused by an abnormal bladder that contracts and squeezes when it's not supposed to. So the bladder will start contracting, which causes this intense urge to go pee. And sometimes that urge is so great that you can't hold it any longer, and you leak out urine if you can't get to the toilet in time. If you're getting these bladder contractions with urges, but you don't actually leak urine, it's a complex called overactive bladder, which you might have heard of before. So overactive bladder is characterized by 3 symptoms. So urgency, so that's the intense feeling of the need to void. A normal urge, you can usually, deter till a little bit later until you can get to a bathroom. This type of urgency, it's usually results in leakage because you can't suppress it. Urinary frequency. I want to apologize. I have a puppy that my mom is trying to keep in the basement, but she's barking, so I apologize if you can hear her. Urinary frequency is avoiding more than 8 times a day, and nocturia is having to get up more than 1 or 2 times in the night to void as well. So the urge that your bladder creates from the abnormal contractions actually wakes you up in the night to have to go pee. So management, like general measures to normalize your bowel habits are really helpful in managing overactive bladder. Since your colon and bowels share the same little space in the pelvis, if you are constipated, it can actually push up on the bladder and cause it to be irritable and contract, and then create those contractions. There's a lot of actually coexisting medical conditions as well that can cause urinary leakage. So things like diabetes, poorly controlled diabetes can cause an increase in urine production. So if you have a lot of urine, you might be having to visit the toilet more often just because your body has made so much urine. Congestive heart failure or disease in your lower legs, that causes edema in your legs. When you go to bed at night, that fluid, because it's in your lower, it kind of pulls in your lower legs because of gravity, but when you go to bed at night, it actually is allowed to kind of, shift back into your bloodstream. It goes through your bloodstream, goes to the kidneys, more urine's produced. So you'll actually make a lot of urine at nighttime. So if you do have swelling in your lower legs, and you want to get a good night's sleep, a good tip is like towards the evening, kind of get your legs up in the air, like when you're watching TV, help get that fluid and swelling away then, so that you can have like one good pee before bed, and then you can go to bed hopefully with not a full bladder. Another interesting, I find it interesting, is sleep apnea. So when your brain at night, so if you have sleep apnea, like usually treatment, you get a positive pressure airway, you wear CPAP. So if you have sleep apnea and you're not wearing your CPAP, there's actually times when you stop breathing and your brain senses that you're not breathing, and it actually creates a hormone that produces urine during the night. So ladies, if your husband is snoring a lot and they might have sleep apnea and he gets up a lot to go pee, get that checked out. Other management, weight loss, so can take pressure off the bladder, let it expand more. That will help prevent the abnormal squeezing, as well as smoking cessation. So cigarette smoking is a bladder irritant. It's going to make that bladder want to just, it's going to make it irritable. It's going to contract whenever it wants. So trying to stop smoking if you do smoke. Nicotine replacement therapy, or a program for smoking can be helpful for that. This one, whenever I tell this to anyone, they don't like to hear it. So caffeine is a bladder irritant. One study found that reducing caffeine to less than 100 milligrams a day can significantly reduce episodes of urinary urgency. You don't have to completely cut caffeine out. You can just try swapping your regular coffee. Like if you have 3 cups in a day, just try to cut back, or, you know, switch with 1 cup of regular coffee, switch it with a cup of decaf, or do half and half, that kind of thing to try and, you know, reduce it. Fluid management. So it's recommended to drink 1.5 to 2 liters of fluid per day to prevent dehydration. So when you're dehydrated, your urine becomes concentrated, and that concentrated urine in the bladder can actually cause it to be irritable and contract. However, drinking more than 2 liters of water per day can cause excess production of urine, which can mean more trips to the bathroom. When counting fluid intake, things like soups and jello, like those kind of like liquidy foods, also count. You can get her. So there's irritating foods and beverages. This is just kind of a chart of some foods and beverages that are known to have caused, you know, overactive bladder. This doesn't mean that every person will react the same way to each kind of food. We kind of suggest you pick one at a time, kind of try to eliminate it from your diet for 1 to 2 weeks, and then see if that helps. If not, then certainly reintroduce it to your diet. Most common irritants are caffeine and alcohol. So alcohol, not necessarily, like try to cut back, or you can try and substitute with non-alcoholic beer or wine. So as urgency increases, most people try to rush to get to the bathroom, and that's actually the worst thing you can do. Rushing jiggles your bladder, increases your awareness of how full it is, and it just makes it kind of worse. So we try to teach people urgency suppression. So when you do feel a strong urge come on, just try to sit, be still. As the urge grows, you're going to squeeze those pelvic muscles that we learned how to squeeze 5 times quickly, wait a little bit longer, try to wait till the urge subsides, and then you can kind of rush, or not rush, sorry. You don't want to rush. You want to patiently, slowly walk to the bathroom. Again, second line therapy, medications, antimuscarinics, mirabegron. These medications have side effects. So generally, if you're going to start them, like with your doctor or urologist, you basically choose either the antimuscarinic or the mirabegron, whichever side effect you think you can tolerate the most. That's usually the medication you start on, and then you can slowly increase them and actually combine the two to try and treat that overactive bladder. And then Botox is also something that can be injected into the bladder to help. There's also surgical options as well, if nothing else is working. Final kind of incontinence that we'll talk briefly about here is overflow incontinence. So it's the leakage of urine that occurs when the bladder overfills for some reason, that it gets so full that urine just starts to flow out. So when urine kind of gets stuck in your bladder like this, it can be one of 2 reasons. It could either be due to a weak bladder muscle or some kind of obstruction. So we had talked about BPH in the larger prostate that can cause obstruction, or things like a weak bladder muscle, like even medications for overactive bladder, like those antimuscarinics, they can cause, you know, your bladder to kind of stop contracting enough to empty the urine. And what you can do is actually start to retain urine. So if you think you're retaining urine, you might sense, you know, that your bladder is not completely full empty after voiding. Good position on the toilet, such as with your feet apart, supported on the ground, knees apart, lean forward, rest your elbows on your knees. That kind of adds a little bit of pressure to the bladder to help you empty. You can also elevate your feet on a stool. The Cred maneuver is when you kind of take a fist and kind of push down on your bladder, kind of put some pressure on there to help it empty. Double voiding is when you go to the toilet, try to pee, and then once you stop, kind of get up, go walk down the hall, come back and try to pee again to finish emptying the bladder. Sometimes we just can't empty our bladder using these methods, and sometimes intermittent catheterization may be needed. And then there was a question about managing catheter pain. So this would be like the indwelling catheter that's put in after surgery. So securing the catheter is of the utmost importance. When you don't have a secured catheter, it's allowed to like slide in and out. It, you know, if it's resting a certain way on the meatus of the penis, like on the tip there, you can actually get a pressure sore. So definitely having it secured with a device like you see on this gentleman's leg, which you can purchase at places like Shoppers Wellwise and stuff like that. Very important. Also using a water-based lubricant at the tip of the urethra if there's irritation there. If you feel like it's kind of in your bladder, sometimes the balloon that keeps the catheter in your bladder can sit in that area of the bladder neck where your prostate was just removed. So even kind of pushing the catheter in about 1 centimeter and then resecuring it might help with that. And then sometimes an overactive bladder will want to try and push out that balloon, which can be painful. So talk to your doctor about the medications that are used to treat overactive bladder, such as antimuscarinics, to kind of help with that. Okay, so I'm almost done. So this is the phone number for our continence clinic. You could actually don't need a doctor referral. You can just call and self-refer. If you or anyone you know have any issues with continence, anything that you know you want to work on, you can self-refer to that. Usually during the first appointment, we do a whole bunch of history taking, and we'll ask you 1 billion questions to kind of figure out what the problem is. And then you're usually sent home with homework, which includes a bladder diary, recording what time, you know, how often you're peeing, how much you're peeing. We send you home with a measuring hat that goes in your toilet, just to kind of figure out what's going on. And then the next time during a second appointment, we do some more testing. We check to make sure you're not retaining urine in your bladder, and then kind of come up with a game plan at that appointment. And then the appointments from there on after, basically, you know, checking progress, readjusting the plan as needed. I will paste this into the chat, our phone number afterwards. And then it was mentioned in the Kegel exercise video of pelvic floor physiotherapists. So they basically help to strengthen your pelvic floor muscles, and they have a lot of equipment that, you know, can tell you, are you actually, you know, using your pelvic floor muscle, that kind of thing. So these are some physiotherapists in town and their contact information if you ever wanted to go to one of them to help with pelvic floor strengthening and whatnot. And I will paste this in the chat as well. Okay, so question time.